Good afternoon, everyone. Welcome and thank you for joining us. I'm Cassandra Williamson-Hopp, the Conference Editor of Benefits Canada, and your host for today's webinar. The coronavirus has seriously shaken things up for Canadians, both in their professional and personal lives. This new normal, for many of us, means working from home and homeschooling. With people reluctant to go to the hospital, an increase in health problems is expected, which organizations and insurers will have to address and adapt to. This afternoon's webinar, sponsored by Desjardins Insurance, will explore how overall wellness, which includes physical, mental, and financial health, is especially important during a crisis, and how going forward, this wellness culture will be an integral part of group plans. Just a few housekeeping notes before we get started. This is an example of an attendee interface. You should see something similar on your own computer desktop in the upper right-hand corner. Please use the orange arrow to open and close your control panel and the audio tab to select your preferred audio, either mic and speakers to use your computer audio or telephone to dial in using the information provided. If you have any questions for today's presenter, please type them into the questions pane of the control panel. You can send in your inquiries at any time. We'll be collecting these and addressing them during the Q&A session at the end of today's webinar. Presenting today's digital event will be Desjardins Senior Advisor in Disability Management, Charmaine Alexander. Without further ado, take it away, Charmaine.
Thank you, Cassandra. Good afternoon, everybody. Hello. I hope it's nice where you are. Where I am, it's a little bit dark, so stormy, but if it is nice, feel free to take me outside. I'm really happy to be there with you and to talk to you about overall health. I'm Charmaine Alexander, and before getting down to business, I've got a question for you. How are you? Simple question. Often what we ask after hello. When we were in the office before, we used to ask that of each other when we'd pass each other in the hall. And normally it was just a simple, how are you? People would talk about typically their physical health, just a brief answer. But now, given what we're going through, that we're all living through the pandemic, we know that how are you really implies a lot more than just what it used to. It's silently asking, how are you physically? How are you psychologically? And how are you financially? Because in this time, we're establishing a new normal, and it's now evident more than ever that the physical, psychological, and financial are all interconnected. At Desjardins, we call the equilibrium between these three components overall health. They interact like balls in a pendulum, and what affects one will affect the others. So prior to the pandemic, back in May 2018, Desjardins conducted a survey. We wanted to really measure these interactions so that we could better understand how they affected each other, and we could be better equipped to see what was coming and to respond to it appropriately. What did our survey find? It found that 83% of healthy people say that they can manage their financial stress. 73% of financial healthy people also reported being in good mental health. Conversely, 43% of people in poor physical health said that they were having difficulty managing financial stress. And 61% of those in fair or poor financial health did say that they struggled with mental health issues. So clearly these three factors are closely linked no matter what your situation is. And that was before the pandemic. In March 2020, wow, the coronavirus completely upended all aspects of our lives. Work, family, recreational activities. Suddenly kids weren't going to school anymore. We couldn't see our parents, our families, our friends. We were working from home and we had to line up for groceries. The world as we knew it suddenly imploded, giving way to uncertainty and more questions than answers. Are my parents okay? Are my groceries safe to eat? Will I lose my job? Can I retire on time? Should I wear a mask? After 6 weeks of lockdown, the research firm Angus Reid did a survey and asked the Canadians the question I asked you at the beginning at the presentation. How are you? First is the good news that a third is reporting that they're doing well. But for the others, there's another story. Let's start with physical health. We know that the virus attacks the body directly and indirectly. You might be asking yourself, what does that mean, directly and indirectly? And let me explain. Since March, we've been given a lot of information about the virus. Especially if you watch CNN, we know how it can spread, how we can try to contain it. And this is what we would call the direct effect of the virus. The indirect effect talks more to how the presence of the virus has affected people physically, even though they haven't contracted the virus. While the economy has all but ground to a halt, chronic illnesses have not gone away. There have just been fewer diagnoses since people haven't been able to see their doctors. And we're seeing this in emergency wards because people just aren't attending. They're afraid, and they're not sure if that's a good place for them to be, even though they may be suffering from some other health condition and not just coronavirus related. So given all of this, we can expect as insurers to see the disability cases probably rise in quarters 3 and 4 because people are still getting sick. They're just holding off diagnosis and treatment. Radical lifestyle changes have also taken a toll on physical health. For 2 months, Canadians were told to stay at home, and we did. 63% of us reported that we were watching more TV, 22% spent more time playing video games, and 25% were drinking more, according to another survey. 4 in 10 Canadians have also reported having difficulty sleeping. The lockdown is also affecting our diets and levels of activity. Many people have gained weight from lack of exercise. I don't have the numbers of obesity in Canada, but a study in France said that 57% of people reported gaining weight during the lockdown. For people suffering from obesity, a chronic illness that affects over 7 million Canadians, according to our partner, Obesity Canada, the current situation just makes that problem worse on a number of levels. I'm not judging anyone. We're all doing the best that we can. But our role as insurers is to anticipate the consequences of all of that. Less physical activity, more alcohol, more calories, and chronic lack of sleep. These are all ingredients of a time bomb. On top of physical issues, employers are also dealing with the ups and downs of their mental health. The Center for Studies on Human Stress, yes, that is the thing, identified that the 4 main stress factors, and it only takes one of the 4 factors to really trigger a stress reaction. But since March, we've been having all 4 on a daily basis in our day-to-day lives. So the 4 stress factors are, first, novelty. We haven't seen a health crisis like this since World War I or through the Spanish flu. Unpredictability. Facts about the virus keep changing from one day to the next. Threat to ego. Some people have lost their jobs or are afraid of losing them. And sense of control. We have no control over the virus or how it develops. That acronym spells NUT. And again, when we're talking about stress, it only takes one to trigger a stress reaction in us, but we've been dealing with all 4. And what does that result in? 50% of Canadians were reporting that their mental health has declined. And a study done at Sherbrooke University said that 26% were experiencing symptoms of post-traumatic stress disorder. And prior to this, we were seeing about 5 to 10%. So there is a jump in that reporting. How about financial health? It's no secret that people were struggling with finances prior to the pandemic. We knew that 44% of Canadians reported living paycheck to paycheck, and people have been hit hard by lost income and mass layoffs across several different economic sectors. When you think about restaurants, air travel, tourism, entertainment, all due to the high cost of living, many people didn't have savings to fall back on. As a result, by the end of April, 1 in 3 Canadians reported that the situation had affected their ability to pay their bills and meet their basic needs, like rent, mortgage payments, utilities, and groceries. Now, thinking back to that image of the pendulum with the 3 spheres of health, you can easily imagine that the combined effect of the current situation on overall health. Here's that key number to remember. 26% of Canadians are in mental and financial survival mode. They're the ones struggling the most, with 25% of them also reporting having trouble with their relationships at home. There have been articles suggesting that social distancing at home has also increased the divorce rate. That means that 1 in 4 Canadians aren't doing well, and our employees, your employees, could very well be among them. For companies, this can lead to a drop in employment engagement and productivity. Normally, teleworking boosts productivity by about 13%, but things really haven't been normal for 3 months now. Employees have been pouring a lot of their energy into learning how to be resilient. They have a lot on their minds. Employers have had to adapt to this reality. Few had contingency plans in place and had to deal with this catastrophic event. They had to act fast and adapt on the fly to their employees' new needs and expectations. So the first of these expectations were new work tools. In just a few days, employers had to shift and have their entire staff working to teleworking and video conferencing mode, a huge challenge in terms of technology, training, and standardization. To add to this, there were personal expectations. Stuck at home with their kids, employees needed their bosses to have compassion and be flexible with hours, deadlines, because compassion was needed to understand what people were going through. And it quickly became a buzzword for the managers. The third expectation, especially from those who may have lost their jobs, were information and support, such as the government assistance and relief measures offered by insurance companies and banks. It's as if this crisis has given rise to a new bond of trust. Let's look at this, the employer's role in this new relationship. So when we talk about managing with empathy and looking back at the timeline of events and their impact on management style, we see that in phase 1, so this is what happened in March, the economy was put on hold and the lockdown measures were introduced. The primary objective for both businesses and employees was survival. As the previous slide, as many as employers, you had to take action and implement emergency measures. Your communications had to be clear, transparent, and conveyed with empathy. And for those employers watching here today, I'm sure you can relate to this. In April, we moved to phase 2 with the need for security and guidance. That meant businesses and employers had to show that they were confident. They had to reassure their employees about their jobs and their future. Employers encouraged their employees to focus on their strengths at work and to work within their comfort zone. If that meant flexible hours or being at home and working around children, they had to be compassionate and let them know to work within their comfort zone. Employers needed to take that compassionate approach and understand. Today, we've started to see the ease up on confinement rules and restart of the economy. And we're somewhere now between the phases 3 and 4. In May, we entered the belonging phase. People were gradually adapting to their new normal, their new routines, and they wanted to connect or reconnect with others, their community, their colleagues. We set up video conferencing platforms and virtual happy hours or lunch hours to help foster unity. Communications took on a lighter, friendlier, and less serious tone, but we're still empathetic. This is important because work relationships are 1 in 5 of the drivers of workplace happiness and account for 45% of a person's overall job satisfaction. In phase 3, we tried to rekindle this driver and renew team spirit. So today, in June 2020, we are preparing to enter phase 4, realignment. So this is where employees will think back on their choices. They'll look back on the way that they coped, on what the crisis did to their personal and professional lives and the support they received. And this is normal and very healthy. They will make personal and professional decisions. They'll want to make sure that their company and their company's values are still aligned with their own. And some will actually jump ship and seek new employers. Organizations can also take this opportunity to reassess their values and fine-tune their employer brand to develop a culture that's stronger than ever. Their communication should convey authenticity, even if that means that they made a mistake. A little later in the year, once we're in phase 5, companies and employers will work on formalizing those new practices that have emerged over the last few months. Teleworking, work-family balance, and compassion. If they haven't done so already, employers should express their appreciations for their teams, who will come out of this slightly worse for wear, but more tightly knit than ever. A new reality, or rather a new normal, will take hold. To sum up this transition to empathy, I would say that this pandemic has led us to take better care of our employees. The companies, employers that weather the storm will be those that have risen to this challenge. A professor and consultant, Jean-Pierre Brun, coined an expression a few years ago that's more pertinent than ever now. He said, it's time to go from managing human resources to managing resources humanely. So as we move into the future, humane management means, number 1, implementing a culture of overall health. So combining the physical, the mental, and the financial health can no longer be overlooked. It needs to be embedded into our cultures. Fostering empathy and managerial practices to improve the employee experience. And number 3, choosing business partners known for treating people well and giving back to the community. This shift to more compassionate management practices happened almost organically in some organizations. The key now is staying the course throughout this crisis as it becomes a long-term reality. Physical distancing and teleworking may be here to stay. And as wellness experts, we're happy to provide you with a few solutions to stay the course. The first key into moving into our new reality is information. Information is the key to success, but moreover, the way that information is delivered is the key to well-being. So as your employees are still at home and expressing maybe some difficulties and looking for where they can find reliable information, we know that watching TV and listening to the news once a day is probably more than enough. There's no need to stay glued to it because it does cause a lot of anxiety. So when they do come to you as employers and ask you if there is any other information that they can get, or when you disseminate information and links in meetings, it's really great to make sure that you can give them those alternate reliable resources. For example, for anything health related, you can encourage them to consult consult their trusted websites, other reliable resources, Partners Health and Wellness platform. So often those are full of advice and articles that employees can read at their leisure. And again, the content is reliable and less anxiety provoking than some of the things that we're seeing in the media. At Desjardins, we actually saw a spike in visitors to our health wellness platform, Health is Cool 360, in the first few weeks of the pandemic, which goes to show you that it's a trusted resources and people were looking for information. Many insurers and health partners also added videos and webinars on the situation. For example, as soon as the markets crashed and there was financial instability suggested in the media, we posted a video online to reassure plan members about their financial portfolios. It talked about best practices to adopt, remaining focused on established objectives and not to make any hasty decisions. Many of our plan sponsors proactively shared the video, and employees responded to it and were looking at it because it responded to a real need. The news was making people very anxious about their financial future, and they wanted a credible point of view. In the end, our video was viewed by thousands of plan members across the country. This is just one example, but it really shows that it's more important than ever for employers to promote and share all of the tools their insurers, vendor partners provide. It's an easy and inexpensive way to help employees regain peace of mind. Beyond information, employees may need personalized help to overcome some of the challenges they're facing during the crisis. Again, your insurers can be an ideal partner. When we go back to the first few slides and we're talking about interrupted sleep and nutrition, we know that many group plans now include one-on-one coaching. So again, tying back to some of those earlier statistics, take advantage of that as employers. On the financial side, for example, Desjardins offers a global integrated experience. It gives plan members savings information, tools and services, and appropriate recommendations to suit their individual situation. Each plan member has convenient access to counseling on their needs, their goals, and any issues that might concern them. It incorporates financial wellness into their lives. And the industry has also developed new wellness programs that are proving to be very effective in providing support for their employees. In the same vein, there are also a whole range of new technological options available to help their employees stay healthy. Virtual healthcare or telemedicine, which enables patients to consult a healthcare professional by phone or by tablet for non-urgent problems. It's definitely becoming more popular, and through the pandemic, it's been shown to be a really valuable resource, not just because it saves employees time, but because, as I mentioned before, people were not seeking help because they were afraid either their doctor's offices were closed or they didn't want to attend an emergency ward. Better mental health tools are also emerging. Employee assistance plans have also been incorporated with artificial intelligence into their member portals. So this is a nice way to sort of get into seeking assistance. You might have employees that are not as forthcoming, and we've seen that this is something because they are more they have a tendency to seek out technological solutions right now. They might be able to try the artificial intelligence, which could lead to also counseling down the road. Before talking to someone, employees fill out an interactive online questionnaire, and it makes patient care that much easier and employees a level of comfort as they're at home. Also, online cognitive behavior therapy or internet-based cognitive behavior therapy is another means of reaching people in the comfort of their own homes, at their convenience, and also still respecting social distancing rules. Virtual services are also part of the employees' new expectations. One recent study shows that 62% of Canadians are willing to consult a professional over the phone for mental health services, compared to 40% before the crisis. It's as though circumstances have broken down many people's resistance to technology. This is a great opportunity for employers. Now is the time to add high-tech tools to group insurance plans. Communication is also part of the solution. While it is obvious that employers cannot be their employees' friends or therapists, but right now, employers are a source of moral support, and it's important to develop a new way of communicating, focusing on listening. It is important to be responsive to your employees' needs and expectations and concerns. Asking, how are you at the start of a conference call is well and good, but listening is even better. Not just with your ears, but with your eyes and your heart. The idea is to pick up on any early signs that you might see in your employees, being neglected, feeling tired. Are they replying to emails? Are they meeting deadlines? Do they seem groggy if you see them on camera, or in their voice if they're talking to you on the phone? If so, they may need help, and listen to them and offer resources when you can. Communication also means maintaining social interactions between team members and holding informal online meetings. For example, morning coffee chats or lunch hours, or I have a colleague that enjoys having a challenge in internal team meetings where they pick a theme and they dress up when they come to the camera. So things like that, where you can still maintain that social aspect. And when you can, maybe referring colleagues to websites where they can buy needs, such as when you found something that's helped you or assisted you through different websites, such as Amazon. Maybe you're looking for masks or gloves, and you know that a good website to get that from. Sharing that with your colleagues is also a good way to stay in communication. So as you can see, managers, team leaders, and supervisors are the cornerstone of this overall health approach. but its success also depends on getting support from senior management and strengthening organizational practices. So what exactly is that? What exactly am I talking about? Essentially injecting a good dose of warmth and humanity into your management of people and your business. But let me explain. So even though Gen Y and Gen Z employees account for an increasingly large proportion of the workforce now, many organizations have stuck to the baby boomer and Gen X way of doing things. The hierarchy, objectives, performance, strategy, sense of duty, these are all very vertical. With the pandemic, organizations were kind of forced to adapt new practices like flexibility, solidarity, performance transparency, which are typically horizontal and more sensible. And these are the values of the young employees. So the horizontal revolution was already going on. The current situation has just accelerated its course. It's really one of the only good things to come out of the pandemic, the introduction of heart into business. I like this image of baking bread at home with the kids. I know that a lot of it have done that. I'm sure everyone's eaten their share of banana bread. There's something comforting and elemental about it. We're in survival mode, but we're humans with a lot of know-how. I think that's a good way to wrap up this webinar. So to summarize, the concept of overall health is the next step in the evolution of employee benefits. It should be at the center of business plans, driven by values like goodwill and cooperation. In the current situation, the new model naturally fell into place. Faced with a crisis, companies had no choice but to take care of their employees' physical, mental, and financial health. They had no other option but to alter their organizational practices to come up with a new way of working together in the spirit of cooperation and collaboration. In the future, this will be the new normal because it touches on all components of health and drivers of well-being at work. Thank you for your attention.
Thank you so much for such an Oh, there we go. I said thank you so much for your insightful presentation, Charmaine. I'd now like to open up the remaining time we have to address some questions from our live audience. So our first one would be, what are the strategies for identifying and managing disabilities if the remote working trend continues?
Yeah, so as I mentioned, that there is a difficulty in that. Being physically present, it was maybe easier to see some telltale signs, but as I mentioned in the presentation, this has forced us to be look at different signs. So maybe as a supervisor, manager, or even in colleague to colleague, looking for subtle signs like having conversations with someone. So not just for business purposes or setting up meetings, as I mentioned, setting up some meetings to be even touch on socially, ask somebody how they're doing, and watching those cues. If they're on camera, listening to their voice, maybe there's something that you noticed that isn't normally there if you deal with that person a lot. So again, looking for those little signs and trying to connect them with the right resources. If they're vocal about it, or if they're your colleague might say, I'm really struggling, I don't know what to do. Having some resources on hand, like the Canadian Mental Health Association has some great resources. The Mental Health Commission of Canada also has a lot of a resource hub. Your partner insurers, I know that we have our employee assistance programs. We encourage people to look at our wellness sites. Again, managing disability will look different and feel different, but at the same time, we really have to be more vigilant because we know that all of these stressors are likely going to lead to more disabilities.
Okay, thank you, Charmaine. And with the past 3, almost 4 months behind us, would it be a good plan sponsor strategy to have a comprehensive digital online potential lockdown 2 plan ready to activate?
Yeah, I think that's what we've all learned. As I mentioned, that nobody could have predicted this. And it certainly has taken a lot of employers by surprise. And even though you have contingency plans in place, there really isn't, as I said, this is novelty. This is novel. This is something that we haven't seen for in years since World War One. So again, even though we have contingency plans in place, this was probably not one of them. So of course, as we go forward, it's always best to learn from what we've seen in the last 3-4 months and take that and move forward with it. So as much as you can, having that contingency plan in terms of understanding what's happened, like people are teleworking, social distancing, all of those things, and what we need to do, what you would need to put in place as an employer to make sure you have that plan going forward. If we have to see a rise again, as we've also seen that's a warning that there may be another surge. So again, being proactive and taking what we've learned thus far and building it into a contingency plan is definitely recommended and very good idea.
Thank you, Charmaine. And will Desjardins provide consolidated reports to a plan sponsor that includes data from the healthcare benefit virtual care providers and an EFAP to allow the employer an opportunity to be proactive in the management of stress-related issues?
Yes, as a senior advisor in disability management, I know that we are tracking a lot of what we're seeing through the pandemic. And as I mentioned, we are in anticipation that we may see a rise in Q3 and Q4 for people that may be going untreated or may be ignoring or putting off seeking medical help because of the current situation. But yes, if it's data that we have and data that we can report, we're definitely open to sitting down with employers and really letting you know what's been happening and how we can work together collaboratively and in our partnership to help weather through this, get through that storm.
Great. And what are some of the ways we can help our people with financial wellness?
So again, your resources, your partners, Desjardins, if and any group retirement plans, partners that you may have as employers, a lot of it's not really. We're moving into the future where retirement plans have to be more than a retirement plan. So making use of any of the resources that they have, likely because of the uncertainty now, a lot of financial institutions, organizations have really been front and center. You see that on the TV. We're here for you, trying to really promote that security and give reassurance to your employees. So taking advantage of all of that, maybe they have some pre-recorded things, pre-recorded videos or pre-recorded messages or articles. Introducing that to your employees. Maybe you have a scrum or a group meeting or a social hour where you can tell your employees, your colleagues, hey, I read a good article on financial stability or financial savings. Really promoting that with each other, but definitely making use of any of your partners, because again, everybody has had to really respond to this. So financial organizations do usually have some type of resource and tool that you can share with your employees. Maybe there's you do a lunch and learn WebEx or team meeting as well. Really trying to think creatively outside the box. And partners, your insurer partners, Desjardins, your financial organizations, I'm sure would be happy to come up with some solutions with you.
Great. And what are some health and safety considerations for employees who work from home?
So again, when I talked about really telling them to work to their strengths, to work to their, take breaks. I know I have a friend who works in the public health system, and she was talking to me about really trying to work-life balance, because as you know, there we've seen increased caseloads in some of our wellness partners, and she has been seeing that in herself. And she was saying that in trying to manage her caseload, she was ignoring break, but her employer was saying, no, you really have to take a break, and insisting on it, and in fact making it mandatory. So again, really making that message known. And sometimes you have to say it over and over again to someone, because they are worried. Everybody's worried about their job. They've had to become resilient. So sometimes that leads to working overtime, working more, and really telling them that, uh, get up, take a break, especially if you're sitting. A lot of us were pushed at home very quickly, so maybe we don't have the right equipment. We're sitting on a dining room chair rather than getting an office chair. So if there's an ability to even encourage employees or reimburse them, help them financially acquire some of those things to make their offices a little bit more comfortable, their home offices a little bit more ergonomical, that's also something that you can consider. But
Okay. And oh,
no, go ahead.
Someone else asked, prior to COVID-19, we were seeing mental health related long-term disability at approximately 1/3 of all cases.
Yes.
Do you have any early LTD data on how many LTD cases are on your book that are now related to mental health?
We have very early data, so it's really hard to speak to any type of trend right now. And there's also a lot of mental health um, claims that we're seeing, that it may not have even been someone that, as I mentioned, contracted the virus themselves, but maybe have known family members or friends, or even if they had a pre-existing mental health condition, that it's exacerbated through COVID. So there's still a lot of nuance that we are trying to track, and certainly Q3, Q4, we might have a better idea on what those numbers and datas are. It also depends on industry. What we are seeing is that typically those industries where we saw a little 1 in 3 or a little less than 1 in 3, those numbers starting to creep up as well. And again, there's a lot of indirect affect through living through the COVID pandemic. So it's still early, because we started to see the bulk of that data come in March, late March, early April. So really, again, end of Q3, Q4 will probably be more telltale for us.
Okay, and just because you mentioned Q3 and Q4, somebody else asked, how should insurers be adjusting processes to account for disabilities when there may be limited medical when it comes to Q3 and Q4?
So oddly enough, this pandemic has also actually opened up doctors' offices, if you will. So I work very closely with the disability teams here and with the section managers that are heading up the disability teams. And what we found is that before, when it was very difficult to actually get a primary care physician on the line, now it really is much easier, and doctors are more willing to either email or speak to us on the phone. So it's actually opened up getting medical in a more timely manner, if you will. Certainly, we're still getting faxes and things like that, but understanding that it really is challenging for all of us. And this is maybe the new normal. So again, getting that information from the doctor, we've seen a lot more cooperation with them. So through Q3, Q4, we know that if we're not getting that maybe through our internet or uploaded to our secured links, we are able to call doctors now, and doctors are much more responsive to giving us that information, verbal on the telephone, go through a telephone interview with us, and or certainly if we have to fax things back and forth, we're able to call the doctor and tell them the need and the urgency for getting this information. It seems to be that they're more willing because they know that it's not as easy when you're at home and you're not physically seeing your patients, maybe, or even if you have been, to get that information, get that financial security for them, because a lot of times that means a disability payment.
Okay. And somebody else asked, what is the best way to find a balance between keeping the social and fun video chats going on in the workplace to keep employees engaged yet not reaching meeting/video call burnout?
Yes. So that's something that I think it is individual as a supervisor and manager. You know, some managers have that style where it's very it's people have come to be used to them touching base very often. But then there may be other managers, supervisors, or other colleagues that you know, maybe once a month was what the norm was, touching base. So it really is to take I guess common sense approach when you're talking about balancing that. You don't want to, again, overload. So you shouldn't be forcing it. You shouldn't be forcing, saying, oh, I have to have this social meeting call. If you know that you've had one, you know, maybe 2 weeks ago, 2 weeks, a month, but I wouldn't allow too much time to pass before you can, you know, just, it doesn't have to be long. It could be a quick social, hey, let's get together. You know, sometimes people get that meeting invite, and when they see it's going to be an hour, hour and a half, that might be really it might be really intimidating. So maybe it's a 15-minute one, and maybe the subject line is something like just checking in, quick, maybe make it a fun game, like we're going to share recipes or something, or who watched whatever. So again, thinking outside of the box, trying to keep it light, but definitely not burning out, not reaching out that often, and in at the end of those calls and at the end of those meetings, really emphasizing, hey, you know, if anybody's struggling, let's reach out. Let's promise to reach out to each other, reach out to supervisor, manager, or a manager, saying, you know, I really want you guys to let me know, because I have good resources for you, or let me know, and talk about that. So again, I think we need to really approach it through a common sense point of view, and really determine with our teams what that looks like, especially if you know that there's a lot of regular meetings going on. You don't want to necessarily throw that up. Don't make it mandatory, and see how it goes. If you get a lot of uptake, then maybe you know that it was probably a good time to schedule one. But if more people are saying, no, I can't make it, can't do it this week, maybe it's time to pull back.
Okay. And do you have any data on the reduction in case duration when early intervention via CBT is implemented for mental health LTD cases?
Data, yeah. We know that a lot of times when mental health claims happen, a lot of the duration was due to someone not being able to either speak to someone or get in to see somebody. Even sometimes in the early stages where we're looking for diagnosis, maybe this is someone's first ever episode of depression or anxiety, and they're really seeking out. We know that the mental health resources in our health system, we're strapped. We know that it's very difficult to get an appointment with a psychiatrist. It's cost prohibitive sometimes to get an appointment with a psychologist. So people were staying at home and struggling and wanting to see somebody but not being able to see somebody. And iCBT is really a game changer in that it's opening that, because we have seen data where if we can get someone earlier to treatment, or earlier, because cognitive behavior therapy really changes and addresses behavior. So addressing behavior, addressing a lot of those things that are happening mentally, that's huge. So again, the earlier we can talk about that person's issues, they can talk to a professional, they can get treatment, we are definitely seeing the reduction in duration. A lot of, as I mentioned, a lot of that duration was maybe someone wasn't able to get in to see somebody, and especially again through the diagnosis period, maybe they weren't getting diagnosed, so that delays treatment, that delays if there's medications at all. That might look like several trials of different medications. So again, specific data would be specific to a certain industry, a certain client, but we can look through that in our trend reports when we're looking at data for that. But definitely the data we've all seen in disability management, whether it be physical or mental, the sooner we can get in to talk about early intervention, the sooner we can, maybe sponsor treatment if that's required, the sooner we are able to start those discussions on return to work, really identify those restrictions and limitations for accommodation. So identifying early opportunities with the employer to return someone to work, that's huge. So once upon a time back in disability management, when I started, it was very reactive and we would wait for doctors to send us information. But we do know now that getting in earlier, getting someone to treatment earlier is really reducing those durations.
Okay, thank you. And kind of just on this theme of ICBT, do you think virtual healthcare and telephone consultation should be systematically included in group insurance plans given the current situation?
Yes, absolutely. If anything that the pandemic has shown us, it's that we've had to rethink the way we do things. And as I mentioned, before doctors were a little bit more resistant. We never really thought about like doing a psychological session on a tablet, on our phones. But now it's almost like because we have to social distance, it's more acceptable. It's been more acceptable for the last 3-4 months now. And certainly while we were moving that way anyway, now it's sort of given us that need. So yes, it should be definitely included. We're seeing great results, especially for people who maybe, there's a lot of stigma still attached to mental health, and there's still a lot of people who are afraid to reach out and ask for help. But if they're in the comfort of their own homes, in their own room, with the tablet, they may be able to open up more. They might, it lends itself for someone to be more open and definitely get better results and sooner results, as we've seen.
Okay. And just kind of on theme again, would you say that working from home helps employees who are stressed or suffer from mental health issues? Like, can it help?
Yeah, so we've seen with the polls that it hasn't hurt anybody, but we know that through the pandemic, there were a lot of other I guess factors that were affecting people, such as kids not being in school and having to homeschool, younger kids, colleagues with younger kids that were typically in daycare, and now they're not, but they're still required to work and still output during the times that they may have been away from their children. So there are certainly stressors there, and just getting ahead of that and ensuring, again, with compassion, flexibility. I have a colleague I know that has a small toddler, so she has different hours that she works on, and we know that this is what it is. So it's not odd to get that email from her a little later after hours, but because we know that again, you need some compassion and flexibility for our colleagues that have those other factors. Knowing that their management is understanding to this has relieved that stress as well. So certainly the stresses of commuting has been reduced. But again, with the other factors, it's still really important for our supervisors, managers, employers to be mindful of that, and to understand that people are doing the best that they can, and then they're trying to stay resilient in this situation.
Okay. I only have 2 more questions for you, I promise. You've answered a lot in a very short time frame, so I
Sure.
really appreciate it. The next one is, after the pandemic, companies and clients will reduce their office space. Do you know or feel that the industry is planning for this shift to actually cut office space?
I can't say that I know definitively. I know from speaking to clients and speaking to colleagues and um, I guess, human resources. So a lot of the people I deal with are human resource professionals in the various industries, with organizations that insure their employees with us. And it sounds like they are. It sounds like they are having those conversations with employees, even on a personal level, speaking to friends. I've had friends that said, yeah, my employer has already said that we're likely not going to return to the office, and we're working from home full time for the foreseeable future. So I know personally at Desjardins, even we have weekly conferences with our president, who talks and reassures us as to what the next steps are. So I do think that people are, industries are, clients are preparing their workforces, if that is their reality, that they are going to reduce office space. And we've had 3 or 4 months now to really normalize that working from home and what that looks like. So again, taking that all into consideration, I think there is a shift being made, and certainly employers are trying to keep those employees informed and are trying to lay that groundwork, if you were, for what the future holds.
Okay, great. And my last one is, practically speaking, how will an overall approach to health play out in the workplace?
So practically, it's when we talk about overall health, and when we're talking about the physical, mental, and financial health, we know that this has all been affected through the pandemic. So when you talk about implementing it and what that looks like, um, organizations are going to have to, and employers are going to have to think about what they're going to do in terms of wellness, in terms of their values, their organization going forward. They know that when we talk about the 3 spheres of health, that now they should be looking again to their partners, their insurer partners, their vendor partners, and really incorporating that when they're thinking about their overall strategy. So practically, that might look like, for instance, putting in to place, a fund, if there is a X number of dollars that they allow employees to use towards maybe a physical activity, which is addressing physical, mental, because it's usually typically an activity somebody likes, such as maybe it might be a golf voucher or something like that. And it's also addressing financial, because the employer is willing to take on some of that financial burden of someone being able to get out and do this physical thing that might help their mental health. So really thinking like that, thinking outside of the box, thinking about what they can do and what they can put in place. And it doesn't have to be expensive. It could already be built into their wellness, and maybe it means just reallocating things, or relooking at that, how they go about that.
All right, thank you. So unfortunately, that's all the time we have for questions. Thank you for such an informative discussion, everyone. I'd like to thank our presenter, Charmaine Alexander, once more for sharing her afternoon with us today. And I'd also like to thank our sponsor, Desjardins Insurance, for their support and hard work leading up to today's digital event. And thank you to everyone for tuning in. When you exit today's webinar, you'll be prompted to answer a survey. We'd appreciate if you took the time to provide your honest feedback, as this is integral to the planning of future webcasts. Also, Benefits Canada has applied to the Institute for Continuing Education credits for today's webinar. So if you would like to receive these, please indicate yes in the survey. Have a lovely rest of your day, everyone. Stay safe and look after yourselves and loved ones.